Hello and welcome you all. Today we are going to learn about the muscles of larynx. It is very interesting and easy to remember topic. Okay, we have divided larynx muscles into two categories based on their origin and insertion point. Okay, so extrinsic muscles and intrinsic muscles. Imagine the larynx is a small puppet. Okay, so intrinsic muscles, they are inside puppet, and extrinsic muscles, they are outside puppet. So extrinsic muscls, they move whole puppet, and intrinsic muscles, they move small parts of the puppet. Okay, so intrinsic यानी कि strings inside puppet, and extrinsic यानी कि ropes outside puppet. This is how you will going to remember it. Now I am going to give you one more easy formula. Intrinsic means inside workers, extrinsic means outside movers. Let's see the exact difference between them. Intrinsic, they help in small precise movements. They move vocal cords, they are inside larynx, and they help in voice production. And extrinsic muscles, they help in large movements. Okay, they are outside larynx, they move whole larynx, they help in swallowing position. This is the main difference. Now let's see the names of extrinsic muscles. Okay, sternothyroid, thyrohyoid, omohyoid, and digastric. And which are the intrinsic muscles? Here you can clearly see posterior cricoarytenoid, lateral cricoarytenoid, cricothyroid, thyroarytenoid, vocalis, transverse arytenoid, oblique arytenoid, aryepiglotticus, thyroepiglotticus. Okay, these are the muscles. But how will you remember it? You will have to remember its origin and insertion points as well. How will you remember it? The name of the muscles tells you what is the origin point and what is the insertion point. So no need to mug up. If the name of the muscle is cricoarytenoid, then divide this word into two. That is crico and arytenoid. Okay. So it starts from cricoid and goes to arytenoid. This is how you are going to remember the origin and insertion of the muscle from the name. But you must know from exact which surface and from exact which point the origin starts and the insertion ends. There are total 9 intrinsic muscles. Don't you think that it's difficult to remember? Not at all. Not at all. It is very easy. I will give you very easy trick to remember all the intrinsic muscles of larynx. First, we will learn the meaning of the words. Crico meaning cricoid cartilage, thyro meaning thyroid cartilage, arytenoid meaning arytenoid cartilage, epiglottic meaning epiglottis, posterior meaning back, lateral meaning side, transverse meaning straight across, oblique meaning slanting or crossed, vocalis meaning related to voice. So the muscle name usually tells from which cartilage to which cartilage. One more thing I am going to tell you. Posterior muscle, they opens. Lateral muscle, they closes. Cricothyroid, they tightens. And thyroarytenoid, they relaxes. Arytenoid muscles, they bring arytenoids together. And epiglottic muscles, they open and closes the inlet. Now let's see 4 main characters. Okay. Cricoid is equal to ring, thyroid is equal to shield, arytenoid is equal to movers, and epiglottis is equal to lead. Now let's understand them by grouping them. Okay, grouping of muscles will help you in learning. Instead of 9 muscles separately, learning them in a grouping will really help us. Group number 1, cricoarytenoid muscles. Cricoid and arytenoid. So, two muscles are there, posterior cricoarytenoid and lateral cricoarytenoid. Posterior back, lateral means side, their position. I am telling you about their position. And we have already seen what is the action of posterior sided muscles. They opens and lateral sided they closes. So back opens and side closes. Group 2, thyro muscles. Cricothyroid, thyroarytenoid, thyroepiglotticus. So how will you remember? Let's divide these names into two, cricoid and thyroid, thyroid and arytenoid, thyroepiglotticus, thyroid and epiglottis. This is how you are going to remember. Thyroid likes connecting to everyone. Okay. So group number 3, arytenoid muscles. There are two muscles, transverse arytenoid and oblique arytenoid. So transverse means straight bridge and oblique means crossed bridge. Group number 4, epiglottic muscles. There are two, aryepiglotticus and thyroepiglotticus. So let's divide arytenoid epiglottis and thyroid epiglottis. So both go to epiglottis. Group number 5, special muscle. They are related to voice. They give fine tuning. So vocalis yani ki vocal. So posterior they opens, lateral closes, crico tightens, thyro relaxes, transverse straight, oblique crossed, vocalis speaks, epiglottic closes lid. Here I can take your lecture because of these muscles. So these muscles are very important for me. So you will have to remember all the muscles. Here I will show you the chart in a chart format of its origin and insertion. Let's go through the chart. Okay. So posterior cricoarytenoid muscle, the origin of it is posterior surface of cricoid cartilage, insertion, muscular process of arytenoid cartilage. Second, lateral cricoarytenoid, origin, upper border of lateral surface of cricoid cartilage, insertion, muscular process of arytenoid cartilage. Now cricothyroid, origin, arch of cricoid cartilage, insertion, inferior horn of thyroid cartilage. Thyroarytenoid, origin, deep surface of thyroid cartilage, lateral surface of arytenoid cartilage. Thyroepiglotticus, origin, thyroarytenoid cartilage, insertion, epiglottis. Oblique arytenoid, muscle process of one arytenoid cartilage, insertion, apex of other arytenoid cartilage. Vocalis, origin, posterior surface of thyroid cartilage in midline, insertion, vocal process of arytenoid cartilage. Transverse arytenoid, origin, posterior surface of arytenoid cartilage of one side, insertion, posterior surface of other side. Aryepiglotticus, origin, muscular process of arytenoid cartilage, insertion, epiglottis. I hope that all of you have understood this topic very well. If you have any query regarding this, feel free to ask me in time.